Hello, everyone. Today we're going to explore a very important topic that is still often misunderstood in society: mental illness. Although mental health issues are very common and can affect anyone, many people still feel uncomfortable or lack a clear understanding of them. In this video, we will take a closer look at different types of mental illnesses, common symptoms, causes, and treatment options. The goal of this video is to raise awareness and encourage a better understanding so that we can help those around us who might be struggling with their mental health. Before we get started, if you find this topic helpful or informative, don't forget to like this video and subscribe to our channel for more content like this. Now, let's dive in. Mental illness is very common in society. Anyone can experience mental health issues at some point in their life. However, due to lack of awareness or misconceptions, many people miss the chance to get timely treatment or a proper diagnosis. When people think about mental illness, they often imagine individuals who are disheveled, strange, or acting in odd ways. They may picture behaviors like shouting, undressing, or having unpredictable mood swings. However, mental illnesses are much more complex than these stereotypes. In fact, mental health disorders are widespread. For example, depression affects around 6% of the population, anxiety disorders are over 10%, schizophrenia affects 1%, bipolar disorder also 1%, and the abuse of substances like alcohol, drugs, and online gaming is on the rise. 1. What is mental illness? Mental illness refers to conditions caused by disturbances in brain function, leading to abnormal changes in speech, thoughts, behavior, actions, and emotions. Common types of mental disorders include depression, anxiety disorders, schizophrenia, eating disorders, and addiction. A mental health issue is classified as a mental illness when symptoms cause significant distress and interfere with daily life. In most cases, symptoms can be effectively treated with a combination of medication and therapy. Symptoms of mental illness can affect emotions, thoughts, and behavior. Additionally, these symptoms can also manifest physically. Some of the common symptoms include unusual thoughts, behaviors, or emotions, persistent sadness, confused thinking, excessive fear or worry, withdrawal from friends and activities, sleep problems, detachment from reality, delusions or hallucinations, inability to cope with daily stress or problems, alcohol or drug abuse, significant changes in eating habits, changes in sexual behavior, extreme anger or hostility, and suicidal thoughts. Physical symptoms of mental illness. Physical symptoms that can occur include fatigue, back pain, chest pain, digestive problems, dry mouth, headaches, sweating, weight changes, rapid heartbeat, and dizziness. Common causes of mental illness. There are several causes of mental illness. These can generally be divided into physical causes and psychological causes. Physical causes. These include brain injuries or infections, such as encephalitis or meningitis, neurotoxic effects from medications or alcohol, head trauma, brain diseases, such as brain tumors or stroke, and conditions that affect brain function, such as thyroid disorders or chronic kidney disease. Psychological causes. These can include stress from work, school, or life events, as well as abnormal physical development or genetic factors. In some cases, mental illness may arise without a clear physical cause. Common types of mental illness. Now, let's look at some of the most common types of mental illness. Schizophrenia. Schizophrenia is a serious mental disorder that affects about 1 in 100 people. It can show up in different forms but generally involves disruptions in thinking, emotion, and behavior. Some of the symptoms of schizophrenia include delusions, auditory hallucinations, disorganized thinking, emotional flatness, and social withdrawal. Depression. Depression involves deep sadness and feelings of helplessness that people cannot simply overcome. Symptoms include weight loss or gain, insomnia, irritability, difficulty thinking or concentrating, feelings of worthlessness and guilt, a persistent sense of hopelessness, and thoughts of death or suicide. Bipolar disorder. Bipolar disorder causes extreme mood swings, from deep sadness to periods of excessive joy or mania. During manic episodes, individuals may experience elevated mood, overconfidence, increased activity, impulsive behavior, and risky activities like excessive spending or reckless driving. There can also be sudden bursts of anger. Anorexia nervosa, eating disorder. Anorexia is an eating disorder where individuals refuse to maintain a healthy body weight and are terrified of gaining weight. This condition mostly affects women, with a 10 to 20 times higher incidence compared to men. Obsessive-compulsive disorder, OCD. OCD involves persistent, intrusive thoughts, obsessions, and repetitive behaviors, compulsions aimed at reducing anxiety. People with OCD realize that their behaviors are irrational, but they can't stop themselves. Phobias. Phobias are irrational fears of specific objects or situations, such as fear of snakes, spiders, public speaking, or flying. These fears can limit daily functioning and cause significant anxiety. Generalized anxiety disorder. This disorder involves excessive worry and anxiety over everyday issues, often accompanied by physical symptoms like restlessness, fatigue, and difficulty concentrating. This disorder is more common in women and often coexists with other mental health conditions. Substance-induced mental disorders. Disorders caused by alcohol or drug use can cause symptoms like increased heart rate, sweating, tremors, agitation from alcohol, and nausea, muscle aches, irritability from drug withdrawal. Long-term substance abuse can lead to additional mental health conditions, such as memory loss, anxiety, and psychosis. Intellectual disability. This condition involves significantly lower than average cognitive function and challenges in everyday activities. It begins before the age of 18 and can be caused by genetics, infections during pregnancy, premature birth, birth complications, or childhood illnesses. Dissociative disorders. These disorders involve significant disruptions in memory, identity, or perception, often triggered by traumatic events. People with dissociative disorders may feel disconnected from their sense of self and the world around them. Mood disorders. Mood disorders are characterized by extreme emotional states, such as sadness or euphoria. Examples include depression, bipolar disorder, and cyclothymic disorder. Impulse control and addiction disorders. People with impulse control disorders may engage in harmful behaviors, such as stealing or gambling. Addiction, particularly to alcohol or drugs, is a major risk factor for these disorders. Personality disorders. People with personality disorders exhibit extreme and rigid behaviors and thoughts that create distress in their personal and professional lives. Examples include antisocial personality disorder and obsessive-compulsive personality disorder. Tic disorders. Tic disorders, such as Tourette syndrome, involve involuntary movements or sounds. These disorders are often diagnosed in childhood and may continue into adulthood. Diagnosis and treatment. There are many misconceptions about mental illness. Due to stigma and a lack of proper education, many people avoid seeking help. Often, they consult other medical professionals instead of mental health specialists. Overcoming this stigma is crucial for improving access to treatment. In conclusion, mental illness is widespread in society, and anyone can face mental health challenges at any point in their life. It's important to seek help early and get the proper diagnosis and treatment, which may include therapy and medications, to improve quality of life. Thank you so much for watching. I hope this video has helped you gain a better understanding of mental illness and the importance of raising awareness. Remember, mental health is just as important as physical health, and we all have a role in supporting those who may be struggling. If you found this video helpful, please give it a like, share it with others to spread awareness, and subscribe to our channel for more insightful content. Your support helps us continue to create videos that matter. Take care, and see you in the next video.